Mental health issues lie on a spectrum, and that this means we need a broad suite of solutions. We also need to meaningfully organize the services and support available so that people have access to the help they need when they need it. Allow me to build on this point. Let me start by sharing data that we have from the Singapore Youth Epidemiology and Resilience Year Study, conducted by the National University of Singapore in collaboration with the Ministry of Education. This study showed that while 37% of respondents reported having internalizing symptoms like depression and anxiety, only 12% of respondents met the full criteria for at least one of the mental disorders. Furthermore, 6% of the respondents who previously met the criteria for at least one mental disorder more than a year ago no longer had the symptoms. This means that while individuals may experience symptoms of poor mental health, they may be due to transient stressors and do not necessarily warrant the same intensity of interventions needed for individuals diagnosed with mental disorders. Receiving care in the community as a first line of support rather than at hospitals is therefore more appropriate. The cornerstone of our national mental health and well-being strategy is the tiered care model. It sets the foundation for how our mental health services should be organised, with different care levels depending on the intensity of interventions needed. This ultimately helps us to provide the right care at the right time based on the individual's needs. Right siting of care to the community is part of a much larger shift of mental health care. Countries like Australia, Canada, and United Kingdom have implemented a similar model for their mental health care systems. Although more research studies are still being done, existing studies suggest that a tiered model of mental health care delivery, where mental health care can be easily accessible in community settings, is a better approach compared to concentrating services in the hospital settings.